So first thing we have to know in evaluation of autonomic nervous system is what are all the various systems that are controlled and affected if their autonomic nervous system is not functioning properly. That can start from head to foot if you see it's a pupillomotor tear dysfunction, pupillary sensitivity, tear abnormality. These are all the things which you can elicit by taking a proper history. That itself is the first and foremost step in the evaluation. So ask for the dysfunction by the clinical effects on the various system. So salivary gland dysfunction, hypersalivation or siluria, pharyngoesophageal dysfunction by dysphagia, and then thermoregulatory dysfunction by hyperhidrosis or nocturnal sweating, hypohidrosis, and cardiovascular dysfunction, orthostatic hypotension, supine hypertension, postprandial hypotension, non-dipping uh, changes, then gastrointestinal gastroparesis or delayed gastric emptying, intestinal constipation altered by diarrhea, urinary dysfunction, nocturia, frequency, incontinence, and anorectal dysfunction, constipation, defecatory dysfunction, and sexual dysfunction in the male in the form of erectile dysfunction. So these are all the things which you can elicit from the history. So first elicit the history of dysfunction of the various systems in the body due to autonomic neuropathy. Then identify the etiology or cause for that, which she has mentioned, like commonest is diabetic. So any patient with long-standing diabetes, in such cases are given in your practical examination also. Do not forget to examine the autonomic nervous system dysfunction features, as well as see whether there any objective tests have been done to assess the severity of the dysfunction. The bedside evaluation which can be done are cardiovascular reflexes, pupillary changes, and casual sweating patterns. All these things are done. And the objective test that you can do before you proceed to do a objective autonomic neuropathy evaluation testing, you must fulfill these following conditions. Multiple factors influence the function like body function, emotional state, ingested food, medicines the patient takes, or other abuse substances that they use. Caffeine and nicotine should be withheld at least for 3 to 4 hours, alcohol for 8 hours, and all the drugs that are being taken should be stopped at least for 24 to 48 hours, especially anticholinergics for 48 hours. And directly before testing, patients should be laid down or seated for about 30 minutes in a quiet room with neutral temperature and humidity so that they are unnecessarily not stimulated. After you fulfill all these three conditions, testing autonomic function is traditionally done by what is called the Ewing battery test, which is more popular, which involves the variations in deep breathing, variations in the blood pressure and heart rate in lying and standing position, standardized Valsalva maneuver, analysis of blood pressure and sustained hand grip. All these things are coming under the category of what is called Ewing's battery of test. And newer techniques are variability and microneurography is being introduced. So coming to the cardiovascular reflex test, you can have first and foremost is Valsalva maneuver, which can be easily done in the clinical setting itself. And she described what are all the phases. Sometimes Valsalva maneuver itself can be asked as an individual question. So you must describe how you will explain it to the patient, how they have to take a deep breath and hold it and then release it. And what are all the things that you want to check, the pulse rate, the blood pressure, all these things, and what are all the various phases that form the basis physiology of Valsalva maneuver. Then deep breathing, isometric hand grip test, cold pressure test, active standing or orthostatic test, head up weight. I'm not going to spend much time on that. I just explained all these things. And testing the pseudomotor function, thermoregulatory test, which is done to find out the integrity of central and peripheral sympathetic system pathways from the CNS to the cutaneous sweat glands. So the core body temperature varies by increasing the temperature, which in turn raises the blood and skin temperature. and that is how you test this particular function. Then sympathetic skin response, QSRT, pseudomotor reflex test. The test involves mild electrical stimulation on the skin with electrophoresis, which allows acetylcholine, a naturally occurring chemical, to stimulate the sweat gland. And the QSRT measures the volume of sweat produced by the stimulation. And microneurography is a test which is done by stimulating a small portion of that constant electrode contact with a single apparent nerve directly in the fiber, produces the display audio storage, and the impulses formed are all recorded. So this is considered a more of the recent test for measuring the autonomic functional ability. So with the metal microelectrode is so to investigate directly, they identify the neural traffic. So myelinated nerves as well as terminated nerves can be tested, and afferent nerves leading to and coming from muscle and skin in human peripheral nerves are stimulated. And this picture will give you all the details. And noradrenaline spillover test is the last one that you do for sympathetic nerve firing. The overflow of noradrenaline, which is the main transmitter into the venous drainage of organ, provided experimental justification. So measurement of noradrenaline in plasma as a biochemical marker of sympathetic stimulation is done by noradrenaline spillover test, which is also very objective, just like measuring your cardiac biomarkers like troponin. If the autonomic sympathetic nerve component is normal, then when you stimulate, the noradrenaline will spill over into the plasma and you will be able to measure the level. On the contrary, if there is a dysfunction, the stimulation is inadequate, the noradrenaline level will be low. So that is how you find out the thing. Okay, that is what we have to write about mathematics. So first is about the clinical history of various systems, then the objective type of test. So if you classify like that and write, it will be a complete answer. Will you go to the last topic, Usha?
Yes, sir.